Presentation recording has started now, and we'll get started. So welcome everyone. I'm Dr Justin Varney. I'm the Director of Public Health for Birmingham City Council, and I've led the work on the Birmingham Cultural Intelligence Framework, which is what I'm going to be sharing with you today. So we'll be going through the presentation, and as I say, there'll be an opportunity at the end to ask any questions. But if questions do come up as we go along, do pop them in the chat as well, because that's a good way of logging them when they're fresh in your brain. So without further ado, a bit of background around the Cultural Intelligence Framework. So this comes out of work that we did through the Birmingham Lewisham African and Caribbean Health Inequalities Review, BLACK-EAR for short. Which was a 2-year piece of work that started in 2019 and we completed last year. And through that piece of work, we worked with a community panel and a board of academics to take an approach to understand health inequalities affecting our African and Caribbean communities, but more importantly, focusing on what were the solutions, what needed to change. And out of that came a report with 39 opportunities for action and 7 key areas where things needed to change. And one of the key areas was around trust and confidence between communities and service providers. And as we explored that, the language of cultural competency kept coming up. And when we unpacked cultural competency, we realized it wasn't really just one thing. So we then split it into 2 pillars, and I'll talk about them in a second, around cultural humility and cultural safety. We then worked with a co-production group of individuals from the African and Caribbean community, from stakeholder organisations and from the NHS, the council and the police, to develop this framework, and that's what I'm going to be sharing with you today. We also then, as we were developing the framework, tested it with a series of workshops, particularly working with council staff, and over 180 staff contributed to the shaping of the framework. And now we're in the next phase, which is testing the kind of final definitions of each of the domains of competency and practice. But it gives you a bit of an overview, and now I'm going to go into this a bit more detail. So, how do we get here? Well, we looked at cultural competency. It's a phrase that you quite often hear used, but when you say, well, what actually is it? How do people develop it? And then it quite quickly splinters into 2 different things. On one side, it's about how do we interact with each other. On that one-to-one interaction, how do we consider cultural differences on identity, language, beliefs, and behaviours? But on the other hand, it's also how do we make decisions at a strategic and population level that take into account the differences between communities. So we looked at the evidence base around cultural competency, and that led us to really exploring 2 pillars of this. The one-to-one interaction is cultural humility and safety, but that strategic level of thinking and the way that we apply that knowledge and understanding to the way we make decisions comes under cultural intelligence. And today we're going to be talking about the Cultural Intelligence Framework. There have been some other seminars on cultural humility and safety. We're taking a slightly different approach for the 2 pillars because the evidence base is slightly different. Cultural humility and safety very much rooted in practices from New Zealand, Canada, coming from nursing and midwifery. Cultural intelligence evidence base is much more based in the context of leadership theory and leadership research, so much more in the context of businesses from that perspective as well. So without further ado, this is an introduction to the Birmingham Cultural Intelligence Framework. So the framework's designed as a toolkit to help individuals and organisations develop and strengthen and evidence their deeper understanding and their approach to working with different communities of identity. The framework has 7 domains of practice and competency, and individuals work towards demonstrating that practice through taking part in different activities and then using a reflective learning template to submit that to their organisation's learning lead. And we are building, and I'll talk a bit about this at the end, about how we're going to have an audit process of peer review of those self-reflection templates. So we maintain quality, but we also have some validity that what people are submitting is not just a kind of sheet with 4 boxes ticked. They actually have done some reflection. Now, the other thing to say that's important about the framework is although there are crossovers in skills, in domains between different communities, if you're trying to develop understanding for the Pakistani community, that is not going to be the same as understanding our Nigerian community or a deaf community or a gay community. So the framework is designed so that you work your way through the competencies for a specific community of identity. This is not a model where you can do one class and tick off all equality and diversity in one go. It is very much saying we need to recognise that there are real differences between communities of identity, and we do a disservice to our citizens by not acknowledging that and not taking that into account in the way that we learn about cultural understanding. So these are the 7 domains of competency. And I'll talk briefly about each of them, and then I'll give you an example in a little bit. So the domains are designed that you always start with curiosity. And curiosity is about building your knowledge about a community of identity. So you might say, I want to be curious about our Somali community, and you will do a series of activities. You'll do reflective practice against those activities to demonstrate competency in curiosity. And what curiosity is doing is it's building your knowledge. Curiosity is very much about absorbing. So it's reading, it's watching things, it may be going to a lecture, but it's a one-way absorbing of knowledge. You then build on that once you have that competency to understanding. Understanding is about two-way interaction. It's that space where you start to move from having knowledge about something to testing it with people with lived experience, to really developing that deeper understanding of difference between yourself and the community that you're developing the competency about, but also getting into that uncomfortable or comfortable, uncomfortable space to be able to explore what you don't understand and be able to ask questions. So understanding the activities are very much two-way interaction things. Then the framework goes off in 2 directions. If you go to allyship next, and when we talk about allyship, we're talking about moving from understanding to actively or passively demonstrating allyship. And what we want to move away from is people just sticking a Black Lives Matter sticker on their computer, to moving through curiosity and understanding to actually understanding what being an ally means for our African and Caribbean communities. But allyship in a sense is saying I kind of stand beside you, and I'll shout you on from the stands, but it isn't kind of an active thing. And that's where we move into anti-discrimination. Anti-discrimination, if we stick with the context of ethnicity, would be anti-racism. And in that domain, we're looking for people to do skills training about how to disrupt racism when they see it, how to identify it, name it, call it out, and act to disrupt it. So anti-discrimination is a very active competency. In the other branch of the framework, we have conscious decision making. So conscious decision making is about what it says on the tin, making conscious or having in your consciousness as you're making decisions, the community identity and its needs. So you might demonstrate or develop that skill through, for example, equality impact assessment training. Or decision-making training, where you are developing your skills about how to make a conscious decision, but then you're putting it through a cultural competency lens or cultural intelligence lens and going, okay, if I'm in Birmingham, for example, our largest ethnic community is Pakistani. And if I'm thinking about planning design for the city, I might want to, as part of my conscious decision making, consider if we were designing a new park, would we start to consider some of the of Pakistani garden design rather than traditional white British garden design? It's not a brilliant way of describing it, but it's conscious decision making is about making explicit in your decision making your consideration of communities of identity, and doing that from a position of knowledge and understanding, of curiosity and understanding. You build on that to move into that more active phase, which is where we talk about advocacy. And advocacy is where you're not just saying, I'm thinking about this when I'm making a decision. You're actively advocating for a community of identity from a position of knowledge and understanding to be able to say, actually, we should make a different decision because the decision we would have made with conscious decision making, we would have acknowledged that community exists, but we wouldn't necessarily have changed the decision. Advocacy is where you start to move in trying to change the decision. So again, it's a very active competency in the way that anti-discrimination is very active. And then the final domain of practice in the framework is game changer. And game changer is where you take all of these skills and you combine them and you become the next Greta Thunberg or the next Barack Obama or the next Martin Luther King. So you're really moving to that space where you're using all of your competencies to fundamentally change society. We don't expect everyone to move through all competencies. We expect very few people will put the effort in to get to game changer. But we felt it was important to have it as a kind of final level of competency where you're bringing all of the other 6 domains of practice together and practically applying them to make a difference in practical terms. So that's why the game changer exists as a domain. And as I said, you go through the domains for individual communities of identity. Not everyone will want to do much more than curiosity and understanding, but it allows us to have a model in which people can go further if they want to. So how do you develop your practice? Well, you develop the practice in these competencies through a range of activities. Some of them will be knowledge-based, so they'll be receiving knowledge. Some of them will be interactive, so discussion groups, going to lectures, being able to ask questions, attending things like living libraries. Some of them will be skills-based, going on a course about how to become an ally, for example, would be a skill-based type activity. And then at the heart of this, we use reflective practice as a way of capturing it, because some of the feedback we had from communities when we were developing this was, this is all very well and good, but people go to training and they just sit there and they kind of switch off, or they're playing on their phone. You know, how are you going to show that this is changing people's real, true understanding and leading to a change in practice? And that's why we've used reflective practice. Reflective practice is quite common in health and social care. It's where you use a kind of template document, the first section being, what did you do? What was the activity? Who was involved? When did it happen? The second section is reflecting on, how did I feel when I went to this course? What did I learn? What did I see as the gaps? What did I see as my strengths in it? Did I have an interaction with someone? How did I feel about that? So it's a description of the learning and the response. And then the final section is the so what. So I've been part of this activity. I reflected on how it made me feel. And because of that, something's going to change. So how is the learning going to be turned into a change of practice? And as I say, this is a very common model used in health and social care. But it allows us to have a framework so that when people do activities, they actually have to kind of sit and write something to show, and to spend time really thinking about, how has that activity changed me? How has it changed my practice? So that's why we've anchored it in reflective practice. So where we are at the moment is we've done a lot of work supported by our public health graduates to develop each of the domains. So for each domain, there's a kind of simple description about what the competency is. There's then a very kind of short elevator pitch description. Then there's a detailed competency definition. That's kind of techie language bit, because when we're reviewing the reflective practice templates, we've got to be able to kind of go, how do we compare that to what the competency says? So the competency has to be quite technical and say, this is the skill, and therefore you can link it back to the reflective practice. We've been mapping the kind of activities that people can do for different communities, and we're gradually building a database of those. And we've also created a case study, and I'll give you an example of one of the domains in a minute of this. Where we currently are is testing these definitions. So we've been running a range of workshops, and they run until about mid-November is the last one, to test them predominantly with council and NHS staff and local staff from West Midlands Police as well. And we've had really positive feedback on, and there's been some tweaks. People have given us feedback. We have changed things as a result of the feedback. But we're working towards locking all of those down by the end of November so that we can then go out to talk to organisations about the pilot phase in December. And I'll talk about that in a minute. So let me take you through an example of one of the domains. So this is the toolkit component for curiosity. So developing active curiosity is the first step in the journey to develop cultural intelligence. If you're curious about a different culture, then you're open to learning about it and finding out more. Curiosity is sparked in different people by different things, and that's why it's important to have a range of different activity types when developing this competency. So that's the kind of intro paragraph. Then in the blue box, you've got the simple definition and the technical definition. So the simple definition is cultural curiosity is a desire to learn about different cultures through self-motivated behaviour. That's kind of the elevator pitch. Then the competency definition, this is the technical version of it, is cultural curiosity is to demonstrate a commitment and practical application of cultural curiosity through A, identify our own knowledge and understanding gaps about different cultures. Next one, proactively seek opportunities to explore and learn about different cultures beyond mandated training. The third one, reflect on positive impact of learning and curiosity. And then fourth, applies reflective practice to demonstrate the translation of curiosity resulting in learning and practical change. So the competency definition sets out the kind of components that if you, in effect, when you're doing your reflective practice and when you're choosing your activities, you're kind of going, can I tick these boxes? Can I put in something that shows that I am reflecting positively on the impact of curiosity, that I am putting it into practice in my day-to-day work, that I've been proactively seeking different experiences or different opportunities. So the competency definition is designed to give a kind of framework for people to think about the activities they take part in. So then we give people a kind of overview of the type of activities that you might want to use if you were going to do curiosity as your domain of competency. So activities for curiosity are primarily knowledge-based, and you're supposed to do at least 4. You can do more than 4 if you want, but you should do at least 4. And the types of things are things like reading articles, content on a culturally specific newspaper or website, watching a documentary or a TED talk, attending a community event, attending a lecture. But part of the competency of curiosity is going out and finding these things. So although we will give people alongside the toolkit some examples, we are expecting people to go beyond that kind of list of things that they could do, because particularly in curiosity, one of the things is to demonstrate you have proactively gone and found something different and stepped into that space of being curious. And then there's a case study. So for each of the domains, we developed a case study. This one is for curiosity, so I'll just read through it quickly. So Jane is a middle manager in an NHS hospital. She has a busy role working with a multi-professional team serving a culturally diverse community. Jane was recently involved in a complaint from a Nigerian family, and she recognised the limits of her understanding of their culture and that it might have been a factor in the breakdown of communication. Jane wants to start her journey to develop cultural intelligence in her understanding Nigerian culture. She's done reflective practice training, so starts with the curiosity domain. Using the toolkit, Jane identifies several activities that she can use to help develop her curiosity and start her journey. And these included She started reading about Nigeria and its culture at the Nigerian Ministry of Foreign Affairs website. And when she was writing that up in reflective practice, she identified that she really hadn't known a lot about the history of Nigeria or the complexity of the nation. It made her curious to know more. She then watched a news item on going in depth to understand Nigerian culture and tradition on Plus Africa TV. And she reflected on the different style of the TV shows, as well as the discussion of education and family tradition within Nigerian culture. The third thing she did was she went to a community event hosted by a local Nigerian community organisation, where she got to try some traditional Nigerian food. And she reflected on the different tastes and ingredients, but it also made her think that she didn't see them on the aisle in her local Tesco's. And then finally, she looked up which were the most read newspapers in Nigeria, and she identified The Nation as one of the most popular newspapers. And she spent some time reading the articles. She focused particularly on health news, and she reflected on slightly different emphasis in this newspaper compared to what she read in the local newspapers here. Once she completed her 4 activities, Jane submitted 4 reflective notes to her organisation's learning portal for review and assessment. And 3 weeks later, she got her letter going, "You've confirmed this competency and curiosity for Nigerian communities," and it encouraged her in the next step of the framework. And underneath the picture of Jane, we also included a box kind of showing how has this impacted on Jane. So as a result of completing the competency reflections, Jane started to show more interest in her Nigerian patients and their experiences, and was keen to build on this by moving to the next level of understanding. Jane's manager commented on how Jane was showing more interest in diversity and inclusion, and she seemed to be more aware of diversity in her patients, and this was a really positive step. What I want to also highlight is we specifically chose this picture of Jane being a Black woman, because one of the things that has come out in the development of the framework really loudly is recognising that just because Jane is a Black woman, we shouldn't assume she's from Nigeria, and we shouldn't assume she knows all about Nigerian culture. So it's been some quite intentional choice around some of the imagery through this to play that back and to stop people and think. And as we've been piloting this with staff in the workshops, that's been one thing that we've had really positive reaction to just highlight that. So the next phase is what we're doing with the organisation. So organisations will sign up to use the framework, and we will require organisations to be part of a memorandum of understanding, and that's where they make a commitment to providing some staff resource for the peer review process, to making sure that they've got a learning portal that people can submit their reflective templates into, and that they'll issue certificates, and they'll take part in our evaluation. We are at the moment just defining that. We're writing up the document, so that's the next phase of work that we need to do in the run into December. And then the plan is we'll recruit between 3 and 5 partner organisations to pilot this over 23-24. Sorry, it should be over 24-25 with that external academic evaluation. And that's really important because in the area of equality, diversity and inclusion, a lot of what's done is done because people think it's the right thing to do. And there's actually relatively limited academic evaluation of, does the training that people do make a difference to their attitudes and behaviours? So we're really keen as part of this that we build in academic evaluation. And during that pilot phase, we will be focusing on specific communities of identity because we haven't got the resources to get all of the activity packs ready in time. So we're going to limit those, and we're just defining the list for them. And alongside that, the final element is when organisations take part, they will commit to a minimum percentage of templates being peer reviewed. And they will also commit to us having an element of external audit. So we'll be able to go in and take a random sample of reflective notes, which are anonymised, and then feed back to the organisation whether they are hitting the right level of quality as well. So we're developing that framework. But when we think about how an organisation is going to implement this, as I said, they'll sign up a memorandum of understanding. That'll include an explicit statement of commitment. We'll work with the organisation to define their metrics of success. So some organisations may say we want to set a target for the percentage of staff who achieve understanding competency. Others may say we're going to choose 2 or 3 communities of identity and we want everyone to get to allyship over the year for a particular community. But it has to be, the organisation has to kind of own which way it wants to go, because if it doesn't, then it won't put the time and effort into supporting it. As part of this, we will also be looking at what the ratio of peer reviewers is to the number of staff, and we need to learn that as we go along. So around staff members, you have the organisational commitment. The organisation will be expected to lay on some learning activities to support people developing their competencies, the peer review process, and then, as I said, the organisational ambition or metrics as well. So that's the kind of framing of the approach for organisations. And then finally, this is the kind of timeline that we're working towards. So we started developing the framework back in 22-23. This year, we've been really focusing on the toolkits, so developing the domain definitions, the resources that sit alongside them. Over next year, we'll be looking to pilot them with organisations, with the aim that by the time we get to 2026, assuming that the academic evaluation is positive and that this framework does demonstrate impact on people's behaviours, their understanding, their attitude, then we'll be rolling it out as not just a Birmingham resource, but as a national resource. So that's been quite a canter through the framework, but I'm going to stop sharing the slides there and stop the recording, but allow an opportunity now for anyone who wants to ask any questions or explore any elements of the framework.